Thank you for the opportunity to join you here today on this 2020 World Eating Disorders Action Day. What a different world we meet in today. COVID-19 has certainly had both a physical and a psychological impact on us all. May I also start by acknowledging the traditional owners of the land that we meet and pay my respect to elders past, present and emerging. As you all know, an eating disorder is a complex issue, and we know that in Australia at any one time approximately 1 million people are living with eating disorder. But less than a quarter of those people in fact are in active treatment or support. And we also know, based on both national and international research, that the prevalence of eating disorders is on the increase. But what we also know, beyond the illness itself, that this is a whole of community issue. It's multifaceted, and that it's impacted by a whole range of aspects of our life and different aspects of the ecosystem that we live in. But what is most heartening, and the message we want to get out to the broader community, is that people with an eating disorder can and do recover. But during this World Eating Disorders Action Day, let's just identify some of the things that are really important for us all to take home. One is we need to increase community awareness and increase community knowledge and literacy about an eating disorder. We also need to make sure that people have access to services and supports early. And we also need to ensure that people have access to a variety of different services and responses, both at the individual and group level. And finally, we need to ensure that we have a workforce, both medical, allied health, nursing, but also peer mentors and carer peer mentors within our workforce to provide the services that we need. Queensland has had a long-standing commitment to supporting people with eating disorders. Particularly, we have seen further support through Queensland Health's Connecting Care to Recovery plan, where there's been expansion of statewide eating disorder services, but also we at the Queensland Mental Health Commission have supported the previous organisation, ISIS, with both financial and other supports. Can I also take this opportunity during this World Eating Disorders Action Day to thank particularly Eating Disorders Queensland, but also the service providers in the public health system. Can I thank you for everything that you do every day to support people with eating disorders in this state? And my final message to everybody is, let's continue to work together to increase awareness and literacy around eating disorders, and let's work together to ensure that people have access to the right services at the right time in the right location. Thank you.